Hello, today we'll be dealing about another interesting topic, especially when it comes to blood, and it is blood groups. Okay, blood groups. Why I said it is interesting because it is very much needed. To know what blood group is the patient has, and especially in case of transfusion, the transfusion, and to prevent those exclusive blood transfusion reactions. Okay, so we'll deal about this. I'll be dealing about this blood groups in this presentation, a quick summary of various blood groups that we have and various types of transfusion reactions. To introduce what is this blood group, this blood group is actually determined by a protein molecule that is present on the surface of an RBC. Okay, and this is usually an antigen that is been present on the surface of the RBC. Okay, so this, based upon this, we actually group the blood grouping is actually done. These blood groups were first identified by Landsteiner in the year 1901, and for this he has received Nobel Prize in the year 1930. How Landsteiner has actually have done this blood grouping is, or blood groups is, by based upon a agglutination phenomena. What is agglutination? Agglutination is nothing but you can see clumping of cells because of reaction or cross reaction, where between two different type of particles are mixed. We can see this agglutination phenomena, where we can see clumping of those particular cells. Normally, as I said, we have some protein molecule on the RBC, right? Those are nothing but antigen A and antigen B present on the RBC. And we have again antibodies that are actually corresponding antibodies for them, that is antibody A and antibody B, which is present within the serum. However, we have a law that is called as Landsteiner law of blood groups, where the blood groups that we are actually following now follow this Landsteiner law grouping of blood group. What is that Landsteiner law? Rule 1 is an antigen or corresponding, if an antigen is present on an RBC, particular antigen is present, then the corresponding antibody does not exist within the serum. For example, if patient is having antigen A on the serum, we will not have antigen A in the serum. Okay, antigen A is present on an RBC, then there is no antigen A in the serum. If the patient, rule number 2 is, if there is a particular antigen is absent on the RBC, then its corresponding antibody will be present in the serum. For example, there is no B on RBC. No antigen B on RBC, then we can see an antibody B within the serum. Okay, this is the rule number 2. All the blood group system that we have, A, B, AB and O, actually follows these both rules. However, when we are talking about RH grouping, this RH grouping does not follow your rule number 2. It only abides to rule number 1. It is an exception there. So this is about Landsteiner law of blood grouping. And why do we actually need blood grouping? First thing is medically related. Why medically related? In case of an emergency where there is an acute blood loss or chronic blood loss, where a patient requires a blood transfusion, if we does not know blood groups of both your donor and your recipient, then there will be a risk of blood transfusion reaction, where there will be clumping, agglutination of all the body cells, and it can lead to death, or major transfusion reactions which can finally lead to death also. So for medical importance, blood grouping, especially in case of blood transfusion, it is very, very important. A social importance is, so many people are interested in donating blood, which is actually a life-saving maneuver most of the times, this blood transfusion. For blood transfusion, we need blood, especially in the blood banks. What they do is, before a patient donates blood, or at least after the donation of blood, the blood grouping is done, and it is marked with a label on the the bottle that is been, or the packet of blood that is been donated. So this will actually group the blood, so that that blood group person who is in requirement, we can be given the blood that is present within the blood banks. Okay, and for judicial purpose also blood grouping is done. Blood grouping, or the blood groups that a person has, are genetically acquired. They are with the Mendelian, they are genetically transferred from both the parents. So by judicial, in case of parental and issues with the child, then this blood grouping system can actually play an important role in deciding the who the biological father or who is the biological mother of that particular child. So, based again, keeping apart this, we have various blood group systems. About 20 blood group systems are present. 20 blood group, more than 20 blood group systems are present. However, among them, ABO blood group system and RH system are the most commonly followed ones. Okay, and coming to this ABO blood group, ABO, it is A blood group, B blood group. Actually, A antigen, B antigen, and O is where there is no antigen at all on the RBC. Okay, this is ABO blood group system. It is actually based upon the antigen and antibodies that are present within your RBC and the serum. And it is based upon a principle of agglutination and isoagglutination. Agglutination is collection of separate particles of blood cells into clumps. When two separate particles of blood cells are present and they form into clumps, it is called as agglutination. Isoagglutination is when an antigen is mixed with the corresponding antibody. When there is an agglutination, that is called as isoagglutination. In agglutination, it is two separate particles mixing up resulting in clumping, whereas in isoagglutination, a antigen and its corresponding antibody they react resulting in clumping. It is called as isoagglutination. And ABO blood group system, as I already told you, is inherited with the Mendelian phenotype, and it is usually developed by 5th month of fetal life. And apart from on the RBC, we also see this blood groups, especially these antigens in the salivary glands. We see them in the pancreas, in the liver, and also in the lungs. Okay, we can also see this antigens or AB antigens present within that. However, as I told you, this ABO blood grouping system, or the antigens that are present on the RBC are usually developed by 5th month of fetal life. We will not anti-A and B, B antigen. B antigen and antibody A are usually not developed within the fetal system. Usually they are developed after 2 to 3 months of your after the child born. After the child is born, then there will be development of this antigen B and antibody A. Okay, that is how the development of the systems occur. Coming to the blood type, how do we actually categorize the ABO blood group system? Is we have blood group A, blood group B, blood group O, and blood group AB. The blood group A is where there is an antigen A present on your RBC. Remember the Landsteiner's rule. We will not have antibody A here, we will have anti-B here. Okay, and these antigens in the red cell is usually A antigen, and the blood types that are usually compatible to them are the same blood group. For every blood group, same blood group is compatible, and O blood group is universal donor. It is it is acceptable to any type of blood group. However, we have this universal recipient, which is AB. It cannot be given to any other blood group, but it can receive any type of blood group. You can give A, you can give B, you can give O also to AB blood group, apart from giving its own group. And B group is where B antigen is present on the RBC, anti-A is present within the serum, and we have blood types which are B and O blood types. And in AB1, we have antibodies. We doesn't have any antibodies in the plasma, and we have antigen A and antigen B within the RBC, and it is a universal recipient again. And blood group O, in blood group O, we does not have any antigens on the RBC, whereas we have antibodies, both antibodies within the serum. We have anti-A and anti-B, and the universal donor it can be given to any other blood group, and the compatible blood group to it is again O blood group. Okay, we also have certain subgroups in both in two groups, that is in A group and AB. A group we have A1 and A2, thus in AB we have A1B and A2B. Okay, these are subgroups of again blood group A and AB blood group. Now coming to process of blood typing, you can call it as blood typing, you can call it as blood matching, or you can also call it as blood grouping. What we actually do in this blood typing procedure, normally it usually takes less than 2 minutes of time, and the blood that is to be tested is a few drops of blood is taken, and it is mixed with the acetonic saline, or usually 0.9%. On a glass slide, we actually put this drop of blood there. Okay, here on the glass slide we also have test serum, which is nothing but anti-serum, that is alpha antibody and beta antibody. So we have alpha antibody here and we have beta antibody here on the slide, and we put a drop of blood here and a drop of blood here. Okay, if your antigen has A, it will go isoagglutination with your antibody A again. So if it is undergoing isoagglutination, that means it is again A group. Okay. If it is not agglutinating, if it is having B antibody, then it is called, it is again your, it does not agglutinate. Okay. A antigen should not agglutinate with your it should have a different antibody within the serum. That is how you actually do a procedure of your blood typing. And there is something called as cross matching. Cross matching is where we are actually testing the blood of your only the RBCs, right? You actually have to check your donors. We are only checking your donors blood here. You also have to check your recipient's blood within the, for doing this cross matching. And again, coming to red blood cell compatibility, as we have discussed there in the previous slide. And then we have various transfusion reaction, and these transfusion reactions include jaundice. Jaundice because of hemolysis is present there, hemoglobin is coming out, and this hemoglobin again breaks down into your bilirubin, and because of increased bilirubin you can have jaundice. Cardiac shock is present. This again cardiac shock because of hemoglobin is released into the plasma. When it is released into plasma, the thickness or viscosity of your plasma is increased. Because of this increased viscosity of plasma, there will be load on the heart, and this can lead to failure, resulting in a cardiac shock. Again, the toxins that are being released, especially during transfusion reaction, can also lead to circulatory shock. We have renal shutdown also. Renal shutdown in extreme cases again. Why renal shutdown? It is because the toxins from the hemolyzed cells will actually cause constriction of blood vessels in the kidneys, and because of this constriction, what happens? The free hemoglobin will be filtered through the glomerular membrane, and this enters into the renal tubule, and in the renal tubule there can be blockade because of these because of there is no absorption, no reabsorption. It will cause blockade of the tubule, and this can result in anuria. Because of this anuria, it can lead to renal shutdown. In these cases, what happens, if patient is not treated, or if it's not given dialysis, if it's not on a dialysis, within 10 to 12 days, in this renal shutdown cases, patients can die. Okay, and we have other acute hemolytic reactions, systemic reactions, other reactions, constitutional reactions include fever. Patient will have chills, there will be increased heart rate, patient can show hypotension, there can be uncontrolled bleeding, you can see constricting pain in the chest, and because of increased heart load, increased cardiac load, and we can see transfused vein. In the transfused vein, there can be heat sensation can be felt, and lumbar region can show pain, can exhibit pain again, and you can see hyperhemoglobinuria and hyperbilirubinemia in case of within the urine. Okay, these are other acute hemolytic reactions that are occurring. Now coming to RH factor. RH factor is another grouping system where we actually have this RH antigen present on the RBC, and there is no corresponding antibody or any other. We don't have this anti-RH. RH factor is also called as D antigen. We don't have this anti-D within the serum. Okay, it is acquired by an autosomal dominant inheritance of RH factor. Actually, this RH factor was discovered by Landsteiner again, and this was first discovered in rhesus monkey. That is the reason we give it as RH. As I told you, it is an autosomal dominant inheritance of RH factor. And RH incompatibility transfusion reactions are present, which include delayed transfusion. We have erythroblastosis fetalis, hydrops fetalis, and kernicterus. Erythroblastosis fetalis is one common condition that has been encountered in case of RH incompatibility, and this could be because of initially the parent is an RH negative and she has a child of RH positive. At the time of parturition, there will be mixing of the blood, that is RH positive child's blood onto the patient, onto the mother, where mother develops anti-Ds. As I told you earlier, there will not be antibodies for this D antigen in the body unless there is a contamination of, there is a mix of this blood, okay, either through normal blood transfusion or through vertical, from the RH positive child to the mother during parturition. What happens is there will be mix of this blood and body produces this anti-D. Okay, that is anti-D antibodies are produced by the mother. When the mother has a second child, what happens is these RH antibodies during the they pass through the blood, right? They pass through the umbilical cord and they can cause clumping of the RH. If the child second time is an RH negative child, these antibodies, they can actually react to the mother's RH positive, I mean if the child is RH positive again, it can react with those RH positive antigens, and this can result in a condition called as erythroblastosis fetalis. If at all the mother is RH negative, remember for the second time of or within the first child, at the 24th, 28th day and 34th day, give a you have to give anti-D to the mother again, and if the child is born with erythroblastosis fetalis, then exchange transfusion has to be done to save the life of the patient. And we have various other blood groups, like Lewis blood group is present. Lewis blood group is because by Lewis antigen. Actually it was found first in a woman called Lewis. That is the reason they have named as Lewis blood group. This Lewis antigen is of a secretory antigens they are called, because they are present in organs such as saliva and gastric juices also. This can lead to blood transfusion reaction. However, Lewis blood group is not very frequently advocated. We have other system called as MNS system. These MNS blood groups are usually found on the glucophores. About 43 MNS antigens are present. The two genes are present among them, which is glycophorin A and glycophorin B. Importance of this MNS blood group is usually they are sensitive to Plasmodium falciparum, and hence the patients who are having this MNS blood group, they actually are more sensitive to Plasmodium falciparum, resulting in more number of malarial attacks. And rarely we see a delayed transfusion reactions in case of MNS system. This anti-S is actually very much capable for severe hemolytic reactions. And the final one we have is Bombay blood group, one of the rarest blood group. And this Bombay blood group, it was called because it was first identified in Bombay by Bande et al. Okay, and normally this Bombay blood group has a phenotype OH phenotype. In this Bombay blood group, we have apart from delivering this Bombay blood group, remember again needs a same blood group for blood transfusion. Okay, in this Bombay blood group, what happens is, apart from your normal blood grouping, you also have to do reverse grouping or serum grouping. What is this reverse grouping is, this H antigen or the Bombay H antigen is usually present on all RBCs, and we do not have this H antibody. However, H antibody is usually present in some people. So when we are actually, if we don't do a reverse matching, okay, reverse grouping is not done, what happens is this can lead, that is from the recipients, apart from recipients, even if you are not doing a reverse grouping, not just donors to recipient, but from recipient to donor has to also to be done, where a serum grouping has to be done to check for this anti-H in the serum. Okay, this is nothing but your serum grouping or reverse grouping. Usually this Bombay blood group most frequently encountered in patients whose parents had a consanguineous marriages. Okay, and this is about the various blood groups we have, most predominantly the ABO system and RH blood group. We also have discussed a few other blood group systems that are present. Apart from this, we also have various types of blood groups like Dubé system, etc. Buffy system also we have. These are other blood groups which are not most frequently advocated. Okay, this is about blood group, and hope you understood the topic well. Thank you.